and we'll welcome you in for this special program that we've got. We've got State Representative Jeff Shawan, State Representative here in Southeast Missouri, the 153rd District, and also we'll have Dr. Chris Montgomery, local physician, is going to be here to talk about COVID-19, the coronavirus. It's making its way through our area at this point, and it's really important that certainly we'll go over the guidelines that are out there, especially updated phases that they're starting to roll out from the federal government down to the state level. So we're going to talk to Dr. Montgomery about that and what it means to us here in Southeast Missouri and Northeast Arkansas area. So a lot to get to tonight, and we're going to go right to Representative Jeff Shawan back with us. It's been a few weeks, and it looks like it's probably a good thing you're wearing your cap tonight, huh, Jeff?
Yeah, I was afraid you might say something about that. I have to tuck my hair underneath. I'm 7 weeks of social distancing now.
I know it.
And so
it's
my
tough,
hair, I'm glad I can still grow hair. That's the thing, But it won't stop for me either.
Right.
So yeah, I'm wearing a cap because it's been 7 weeks of since I've had a haircut. I've been social distancing seriously now for a good 6 weeks. And the last time we got together was probably right at 6 weeks ago. And we kind of wrapped up and said, with this thing going on with that virus, things may be a lot different by the time we talk again. Yeah. And wow.
Yeah. A whole lot different.
Things are a whole lot different. And I don't want to steal a lot of time because I brought the person I regard as probably the tip of the spear for Southeast Missouri in terms of understanding the threat of this virus and how to put it in perspective, because he identified this very early on, partly because of his background, that this was going to be bigger than what people were thinking it was going to be. And so I brought Dr. Montgomery with me tonight to hopefully give some really good information for Southeast Missouri.
Sure.
And there's been a dearth of information for Southeast Missouri, and out of frustration, because you hear things here, you get things there, you read this, you see this on TV, you hear this on the radio, Facebook, there's anything and everything gets said. And so to me there was this void, and so I tried to fill that void, and I created a website that's www.semostrong.com. So that's semostrong.com, and it's a resource center. So you can find anything from the contact phone number for the EMA director in Stoddard County, to the health department in Scott County, to Department of Labor to find out where to go to see about unemployment, or to SBA to see about a low interest loan or a grant, because people need a place where they could go. And right there you can submit a form, you give me a little information so I can contact you, tell me what your problem is, and I'll try to do what I can and be as resourceful as I can to help you with that. So semostrong.com is where you need to go to find out for Southeast Missouri, where can I take action, where can I go find some help, because we have a real problem in that area. The other thing I just briefly want to explain to your viewers, because there's a lot of confusion about it. They took us back up to Jefferson City for just one day of session to pass what we call a supplemental budget. And people are going, oh, that's $6.2 billion. Where's all that coming from? Well, that's not actually money that's in our hands yet. That supplemental budget is for us to be able to receive those federal dollars, and some of them are beginning to come in. I think around $1 billion has come into Missouri, but we had to provide provision legislatively so that money could get spent. And that money, the way it'll break down as it comes in, is $1.5 billion. If and when it comes in, will go for COVID-19 aid and relief. $1 billion will go for local governments, and I know all the local government people are going, yeah, start that soon, because the local governments are getting hammered.
Yeah.
$300 million for public schools. These are all federal dollars. They're not your Missouri taxpayer dollars. They are your federal taxpayer dollars. We're providing a way for that money to come, when it comes in, to be used and distributed, because we're going to have a budgetary nightmare.
Mm-hmm.
In the state of Missouri, we cannot spend money we don't have. Constitutionally, we're not allowed to do that, and we have to project what a budget will be. Well, who knows what sales tax revenues are going to be, right?
Yeah.
Who knows what when people are going to pay their taxes and how many are going to pay their taxes on time? Projections are impossible. So just to alert everybody, yeah, things are going to be pretty crazy. Just want you to know there's a process that we're going to go through. We're going to try to reduce the pain the best we can, get as much help to you as we can. That's why that supplemental budget was passed, so that when the federal dollars come rolling in, we've got a place to put them. And so that's to give you an update on that. So CMOstrong.com to get some help and information in Southeast Missouri. And you know, we can talk about social distancing. I haven't had a haircut.
Right here. Look at this.
Yeah, you and I, and I like to be close to you.
Yeah,
Normally we're huddled up together.
Yeah, special
sharing our
circumstances.
space,
Yeah.
you know.
Sure.
We didn't measure out 6 feet. I think we're about 6 feet
Out
apart.
there. Yeah.
And we'd love to have Dr. Montgomery sitting up here with us right now. You know, there's not room at the table
Right.
for
Right.
all three of us to be here. So, you know, with that introduction, I would tell you that Dr. Montgomery is a well-known and well-respected doctor for the region, and does a lot of work right here in Stoddard County, where your studio is, and down into the Boot Heel to some degree, I believe. But he brings a lot of expertise, going all the way back to Katrina. As a young doctor, he was involved in helping people in a disaster called Katrina, that unless they're quite a bit younger than you, everybody remembers Katrina. Mm-hmm. And so he spotted early on this thing was going to be big. And so in our region, he was really and truly the tip of the spear in helping people to understand and pushing us, including me. Hey, Jeff, get a clue here, you know, smell the coffee, because this thing is going to impact Missourians, and it's going to impact Southeast Missouri, the people I love the most in this world. And so really, I think let's bring in Dr. Montgomery. I'll probably have a few comments at the end, but I'll give up my chair, and keeping social distancing, I'll get up and we'll let Dr. Montgomery come right now.
All right, now we're with Dr. Chris Montgomery, local physician here from Southeast Missouri. And Dr. Montgomery, it's great to have you here. It's a privilege to have you here to talk to our viewers out there, which you've been gauging this for many weeks now that it's gotten into our backyard here. So how do you feel about where we are right now?
I feel cautiously optimistic. I'm very pleased with the region and the communities that I serve. Their response and the seriousness. The citizens have surprised me, and I think that I'm cautiously optimistic. It's still a very dangerous and deadly virus, particularly one that puts the majority of my practice at risk. And so I think that we're going to see some positive changes be sustained. But it's going to depend on all of us continuing to be very disciplined about what we do as we go into this new phase of the recovery.
Sure. And your responsibilities in the area are certainly vital. You serve many nursing homes and assisted living facilities in the area, so those people are certainly
they're the top of the list of what I worry about. I think that our region is the most at risk from our vulnerable population, which live in large group settings. So apartments where we have lots of geriatric or special needs people, assisted livings that I serve, skilled nursing. Those are the workers and the patients that I'm the most concerned about. Really taking care of and guarding until we do have vaccine capability. So that aspect of my world, I think, is going to be stressful for probably the rest of this calendar year.
Sure. And those demographics of those people, it's tough on those people. You know, they're used to visitors coming in, family, and
sure.
That's a new reality now of not having that contact with family.
Sure.
So
and
people are having it tough out there.
It's starting to show. I see the strain on my residents, particularly those that are afflicted with mental illness. They don't necessarily understand exactly why they're having to be so restricted in their movements. And I'm not sure if your audience is aware, but for the last 6 weeks, anyone in a nursing home or an assisted living has not been allowed to have visitors. They've not been allowed to go out for their activities that fulfill their lives. They've been mostly sheltering in their rooms, where many places have been getting their meals, their activities, their therapies, and that isolation is really difficult. I had exposure to a potential patient who had COVID, and before we got that test back early on, before we understood things, I actually was tested myself and had to quarantine for a couple of days, and even that was difficult in my relatively unrestrictive surroundings of my house. But the vulnerable population and those that serve it are going to be the ones that are going to need our attention as the months and weeks kind of come about us.
Sure. And today's a big day in news. Here on April 16th, Governor Parson extended the stay-at-home order from which the initial date was April 30th, and 24th. April 24th, and he has extended that to May 3rd. So an extension of that stay-at-home order was given today, and also the federal government, the Trump administration, has rolled out 3 phases in their get America back to reopen America, whatever they're going with that. Like 3 phases to start to open up America for commerce and just general.
Sure. I think I got some calls already this afternoon about some frustration that the order, at least in Missouri, wasn't left as it was, and I kind of think that there's an understanding about why. The federal guidelines for phase 1 are going to require a 14-day period where we're going to see sustained dropping of our local cases. We're not there in southeast Missouri. Representative Shawan and I and Dr. Caldwell were involved in a town hall last Thursday. That night we had 10 cases in Butler County. We have 21 tonight. And so we are still seeing the numbers rise. However, we're not overwhelmed by any means, and I think that the healthcare system can start to look at other opportunities for us to serve other healthcare issues other than coronavirus. So phase 1 for the federal government is we're going to require us to still keep kids out of school. We're still going to keep all of the facilities pretty much on lockdown. We're still going to have only groups of 10. But if businesses, restaurants, as I understand it briefly looking at it before we started, if they can accomplish those guidelines, then they're going to, on a state-by-state level, be allowed to make a determination on what kind of services those will have. Then it's going to be another 14-day monitoring that if those things hold and we don't see a blip in cases, then that's going to go to, I believe it's a 50-person a limitation. But nonetheless, it does seem like a common sense approach to let the healthier population get back out and get back to work and some of our daily lives, which really is important, because the unforeseen consequence of poverty, either literally or figuratively, losing your job, losing your health insurance, not getting preventative care, not taking your medications because you don't have access to them, that is going to have a lasting consequence that it affects my entire practice, not just that vulnerable nursing home practice.
Sure. And I got to see some of the press conference where they unveiled the phases, and Dr. Fauci, basically like what you said, there's going to be a hurdle to go to the next phase.
Yes.
So there's going to be, there's going to be a, like you said, a 14-day period of reaching and maintaining these goals to move on to that next phase. And from where we're at in Missouri, we might be able to move on to phase 1 to start even to those other phases earlier than some of the other parts of the country. So.
And I think it's going to come down to even regions of the state.
That's what I was thinking too.
And St. Louis County and St. Louis City, they're still having a hard time, and the policymakers are trying to do some really unique things, like renting entire hotels to put lower acuity patients in. I think is a brilliant idea. Jeff and I have talked about public policy all of the time, and we're really focused in our region, and with the SEMO Strong kind of network of communication, we're hoping that we can kind of coordinate our response here in southeast Missouri, both with hospitals that we have access to, other medical clinics, other providers, the nursing home aspect of things, and really kind of say, okay, on a state level, the federal government is going to allow each individual state, which I'm a state guy, and I think that's great. And then even more commonsensically, if it snows in Kansas City, we don't shut school down in Dexter.
Right.
Okay, and but if there's a threat of snow across the state, we're all looking at that. And I think that as we go forward, we have to use common sense to start preparing, because this is going to take a lot longer to start, just like it took quite a ways a time to shut down. And we can always stop it if we see that blip. Not to get too technical, but the entire country is connected by health departments from an influenza-like illness network. And so that system is already there. So if we see a blip over the next 2 to 4 weeks locally or regionally, we're going to say, hey, we're maybe not ready to go into that phase 2. But I do appreciate the opportunity that each individual region, county, community, what have you, can make that determination, and the policymakers have a little bit of cover going each way, because right now, fortunately or unfortunately, the medical community kind of has a pretty big bully pulpit, and so we want to be responsible with that. I was one of the people who was like, hey, everybody, we got to really take this seriously and we got to slow down. I feel that same responsibility to follow the science and the data that says, hey, if we're not overwhelmed in our healthcare system, if we're not seeing massive amounts of death, if we're not seeing huge proportions of our population afflicted with it, then we should be obligated to get back to our regular lives, because it was the threat of that, of what potentially could have happened in our region, that caused us to contract so much. So to me, that's what's been on my mind the last 72 hours, is how do we walk that line? And so I was really actually pleasantly surprised at how pragmatic and common sense that the president's plan and the federal government's plan was this afternoon.
Sure. And in Governor Parsons' communications and his addresses, he's been walking that line as well. He knows in Kansas City and St. Louis, they're getting hit hard.
Sure.
Knowing the rural areas and other parts of the state aren't.
Sure.
And he's trying to balance that, and it's tough.
It is
especially
very tough.
When you're
it was very tough, and Jeff will tell you,
state.
as my representative, or my regional representative, and full disclosure, family member, I was going just like our system is set up. I voiced my displeasure with where we were going as a state, and that's the way the system worked. And I think that balancing civil liberties and public health is really, really difficult. Mm-hmm. And anyone who thinks it's not is fooling themselves, or they've never had to make one or both of those decisions.
Yeah, that you see if you watch the national networks, you get the stories across the country about churches being closed and broken up, and you're talking about the First Amendment, freedom of religion, freedom of assembly. I mean, those are tough issues to cross when you're dealing with government.
I'm hoping that access to testing, and locally it's better. In Poplar Bluff, Gamma Labs has been really great as far as developing their own test, and so they're working with the nursing homes, and they service most of the nursing homes. And I'm ordering tests in an afternoon and getting the test back the next morning. That is a huge game changer as far as not having to have staff only serving those residents, particularly in a nursing home, knowing that staff is safe to service other folks. And so as the testing comes on, we're going to be able to sequester sick people, not potentially sick people. And I think that's the biggest thing is if you got a potentially contagious illness, as a civil libertarian, I'm okay with restricting your movement. But if you might have, that's where once we kind of might only is going to last so long. And I think that by the 1st of May, we're going to have enough data to know that what we're doing is either drastically wrong or reassuredly right.
Yeah.
So,
and that you think that's what's really been difficult from the beginning, is that the data just hasn't been to the point of our liking to be able to make informed decisions.
Well, I mean, like, as Jeff and I were talking, 6 weeks ago, I thought this disease had potentially a 2 to 3% death rate. And so if I'm looking, I live in Butler County, if 49,000 people live in Butler County and 10% of the people get it, that's 4,900 of those. And if 2.5% die, that's a lot of people. and a lot more ventilators than we had. And so as we had such an asymptomatic group of people that not only were spreading the illness, that were having it and never knowing it, at least worldwide, that when you look at it and you think, oh, I have more people than I'm measuring have an illness, and it's killing such a large portion. For your viewers, as a comparison, about 1 in 1,000 die from influenza, and all through the winter, late winter and spring of 2020, we've heard, oh well, 40,000 people died of influenza. Well, if 6 weeks ago we thought 10 times more of those people were going to die, and we're still not sure that's not the exact number, but that's where everything got panicky. We don't have a treatment, we don't have a test, we don't know how many people it kills, but we know it's coming. And really, Italy was what I think shocked the world. The fact that they had such a high mortality rate, 7-8%, that their doctors were making these unbelievable decisions, that they really just did not have the ability to even sustain any kind of healthcare system. That's really what got me alarmed.
Sure.
I think that
so.
would be mine.
Speaking to people's behaviors, the guidelines have been out there. They're going to be maintained going forward. I know, a development now is the mask, and you talk about how strange things are. You hear one thing, oh, masks won't really help you.
Sure.
And then everybody wear masks.
Sure.
Sure. Maybe you could just talk to that.
So initially, when we were talking about masks not helping you, if I'm seeing you and you have 103 fever and you're coughing all over the room, and I'm intimately examining you, your ears, your nose, your throat, listening to your lungs, and I have a red bandana across my face, I would be foolish as a medical person to think that bandana was giving me the standard protection from that contagion. Now, it was interesting because my bias is that was all we had 6 weeks ago, and so that's why the CDC kind of lowered that standard. But they did what they thought that they could do at the time. But an N95 mask, which is kind of what's become so popular, that's really designed to keep the person from getting the illness themselves, should they be exposed to that droplet. The mask that we're asking everybody to wear is really more from a spread. So if I sneeze and I have a mask and very few of those droplets get out into the air, you're not going to necessarily walk through that. If I have a mask and I don't leave respiratory droplets on this table, you're less apt to do that, particularly if we're maintaining social distancing, particularly when I know that you'll wipe this table down after I've touched it for 20 minutes, particularly that you're washing your hands, I'm washing my hands. That's where the mask really helps. I was at Walmart this afternoon. I was a little disappointed at how many people were wearing masks. I had a mask on. 2 weeks ago when I wore a mask to Kroger, I felt really weird. Today, walking into a mask to Walmart, I felt like I had a new pair of sunglasses on. And then I walked in and I saw maybe 1 out of 10 people doing it. People that maybe shouldn't have been there. Large groups of people huddled in aisles. And we're going to have to do a better job at that if we're going to continue on the path that I think this afternoon that we're all hopeful that we're on. Because I still circle back to wanting my parents, my aunt, and all of my flock of patients to be safe, and that the longer that we're not practicing those really disciplined practices, then that's going to be more of a risk, and we're going to have to be more restricted in what we do.
Sure. So, you pound this, you keep pounding it. It's everyone out there that make the sacrifices now, so we can get through it quicker to be able to get back to some state of normalcy.
That's really the reason why I'm here, is that I want to go back to regular life. I want to go out to dinner. I would love to travel. I would love to see my patients in person. I've been practicing medicine now for a solid month through an iPad. It's great. I'm thankful that I have it. I'm thankful to stay connected to as many of my patients as I can. But it's not the same, and so I'll be happy to get back to regular life.
Sure. So masks, Not a bad idea then.
Not a bad idea, right? And I think if nothing else, it serves as a barrier that you don't touch your face, because man, I touch my face a lot. Even when I'm trying to be a good steward and a good leader and a good role model for my kid and my office staff and my community, I touch my face way too much.
It's so natural. You get a little you get a little, you get just natural scratch, So what are some other things out there that people could take away from tonight, this program to go forward with? I know we talked about behaviors and what we're looking at from a macro point of view, but what are some other things people need to take away now that we've seen it from afar, that it's the hot spots around the world and even the country. Now it's getting in our backyard. We're up around 19, 20 cases per county probably here in our area. So we need to take.
What we have to do is we have to have discipline. We have to have discipline to fight those urges to have large gatherings. We have to fight those disciplines to do unnecessary travel. We have to continue to make sure that our elderly and at-risk population, we're dropping groceries off to them. We have to figure out ways to continue to fill their spiritual needs virtually as much as we can. And then we have to eke our way back into regular life, so that the next time I drive over to Dexter, I'm not driving past a factory that I've driven by so many times with a parking lot, gushing with cars that's completely empty. That cannot sustain. And so those of us that are able to go out and work those jobs and perform those duties, we need to go out and do it. And then in our non-work lives, we have to remain disciplined and not let up, because the first time that the health department or the governor or the federal government sees a blip on influenza-like illness over the next 6 weeks, they're going to be obligated to shut things back down. And there's only a finite amount of time that our society can sustain what we're doing. As someone who has, business investments and interest in my own practice, this is difficult to continue to see 50% of what you typically do, but at the same time pay all of your staff and continue them. It's not about money, but it is still about money. And eventually, if all of us lose our economics, more poverty and thus more illness and death will follow, and none of us want that.
Sure. I know it's hard to really speculate going forward, but fast forward 5 years from now, will we say, I got the flu? Are we going to be able to? Are we going to say I've got COVID?
Oh, I think that I don't know that we'll ever get to a point with, where we're like a smallpox or a measles type completely eradication. Sorry, I touched my face. But I do think that we live in an amazingly technological world, and they're going to have antibody testing. We're going to develop a vaccine, which I'm assuming is going to be safe and effective. I think that we are going to learn things about some of our public policies about really, when we're sick, truly staying home. I know that that's a banner on everybody's break room in all of our workplaces, but I think that we're going to have to really take that more to heart. But I think that this virus is stable enough, and when we say stable, it should not mutate vastly, that if we come up with vaccine, if we come up with antibody therapy, we should be able to control it. We're just really buying time in a very contagious, potentially fatal illness in a population that dies that we're still not completely sure about. We're starting to see more and more trends, and we know our elderly population and our populations that have more underlying disease, diabetes, hypertension, obesity, lung disease, those are the people who are suffering the most difficult consequences.
All right. So anything else you'd like to share with the viewers out there going forward?
No, I appreciate the opportunity to talk to your audience and spread the word, and I hope that we're all better for this exercise, because it's been really difficult for everyone.
Sure. And really like to, say thank you to Dr. Montgomery coming in tonight and sharing with us about everything going forward with COVID-19. Also, shout out to all the nurses, doctors out there that are doing the work every day. And you talk about the the toll it takes on the elderly that are in the homes. There's got to be an emotional toll with
sure. And the nurse
practitioners
have been great. In our particular clinic, we've had a drive-through clinic for over a month. The wind blew it down, broke the tent up. Cost some unnecessary money, but our nurse practitioners and nursing staff have been amazing because they've been the one in all the space suits that have been out making us look good with all their hard work and dedication. So
okay, I'd just like to go over a little bit of just protocol about if you've got symptoms, what do you do?
Sure.
So maybe just go through that for us.
So right now, I think that if you've got a fever over 100.4, if you've got cough or shortness of breath, we've got enough illness around. We probably want to test you, particularly if you have any chronic illness, if you have diabetes, if you have heart disease, lung disease, if you're a cancer survivor, a cancer patient, or any kind of chronic immune issue, and you have any of those cough, shortness of breath, or a fever over 100, we're going to want to test you. If you're young, you're likely to spread this without even knowing it potentially. It could be hay fever, it's allergy season. And so we can still take our allergy medicine, but we have to just be disciplined about that. The illness can present with nothing more than fatigue, fever, chills, headache, sore throat. Some people, about 10-15% of people have had some GI symptoms. But the patients that we're really the most concerned about, people that are rapidly declining, whether they've been diagnosed or not diagnosed, people that have chest pain, people that have shortness of breath, and anyone over a temperature of 104, we actually want those people to go to the emergency room. And we feel like that the emergency rooms in the region have done an amazing job, and they can sustain it. In the clinical setting, which is more my purview, where we have like an urgent care, those would be the people that we want to know about through the state hotline, and there are multiple different avenues to find out if you qualify for testing. But that is becoming more and more liberal as far as about who we're testing. As we're able to test more and more, and we can get that turnaround in a meaningful way, we'll be testing more. But the ones that really that are contemplating going to the hospital, that would be that temp over 104, chest pain, shortness of breath, or what I like to just rapidly declining. It's better to go earlier than it is to wait to go too late.
Sure. So basically, the best action to take, call ahead to your medical provider. Sure. And
that's one of the things we've tried to do, and I think it's a new thing that we're trying to, hey, call ahead. You're going to drive through, weather permitting, that my tent's up or down. Drive through, and we're gonna swab you and let you go on your way. If you're really in some distress, we're going to potentially direct you somewhere else. But knowing ahead of time is going to allow the system to be prepared for any kind of contagiousness. Right now, for the last month, probably most of us have had our staff assuming that they were going to be exposed, and so knock on wood, I think that the healthcare, at least regionally from what I know, that the healthcare community has been well protected, and thus we're protecting the general public when we give them their care.
Okay, all right. So hopefully we covered about everything we could tonight for everyone out there concerning the COVID-19 virus that still out there and certainly coming to our backyard here, more prevalent in northeast Arkansas and southeast Missouri. And Representative Shawan might end here just talking about those different resources to take advantage of again. And Dr. Montgomery articulated everything as good as it can be with everything going forward with the COVID-19 and all the behaviors and the guidelines that we need to stick to certainly get back to what we considered at one point normal. It's amazing how quickly things change. It was just, a month, 6 weeks ago, and then all of a sudden it seems like the flip of the page. We're in a totally different world now.
Unbelievable.
It is unbelievable. And State Representative Shawan, I appreciate you and Dr. Montgomery coming over and spending some time with us to share with our viewers about COVID-19 and what it means to us here locally. And of course, you got the website up for people to take advantage of.
Yeah, so thank you for giving us a venue to get this vital information out, and information that's geared towards Southeast Missouri. I love the USA, I love the state of Missouri, but I really love Southeast Missouri. And we have had to pull together our resources and try to help ourselves through this whole thing. And the message I got from what Dr. Montgomery was saying is that, hey, pat yourself on the back. We've done a good job. Okay, we have one advantage in that we're rural, we're spread out a little bit more. But I would say, you know, there are some exceptions. We know there's some people who have maybe acted foolish, but the bulk, most of the population has been conforming and helping with this social distancing, and we're going to whip this thing. And so I just want to end on an optimistic note. We're going to come through this thing, and we're going to make the very best of a very bad situation. But by working together, we can minimize the effect. We can protect our most vulnerable population, which, as he was expressing, those are the ones who really are at risk, and a lot of them can die because they have other problems to begin with. So, you know, I think there's a lot of hope. I think there's light at the end of the tunnel, but we need to stay on it now. Don't let up on the pedal. Don't go ahead and host the baby shower that you're dying to have.
It's wedding season too.
Yeah, I know, and the wedding planners are wanting to choke me for saying that. But you know, let's get to the other side of this thing. In the meantime, if there's anything I can do, go to www.semostrong.com, and you can see the whole long resource page, or fill out the short little form so we can reach out to you, ask me any question you want, or anything about COVID, or anything that Dr. Montgomery covered that maybe, you know, provoked a question from you. Send that to me, and I'll get the answer. I'll reach out to Dr. Montgomery. We'll get back to you with that answer, because the more we know, the more informed we are, the better off that we're going to be. So let's all pull together.
Sure, of course. So again, Representative Shawan, we appreciate you and Dr. Montgomery coming over and sharing with our viewers, and just hope great news is ahead. We've got some good news so far. I think we're trending in the right direction. Hopefully we can compound that going forward.
That's right.
Keep that positive trend.
Frustrating as it is, don't let up yet. We're getting close.
Right.
Just hang on. We're about to whip this thing.
Discipline. Like Dr. Montgomery said, discipline is going to be the way out. So.
It is. And we can do that. We don't need the government to tell us how to protect ourselves. We can read, we can understand, and collectively we can take the measures that we need. We don't need a big daddy government telling us how to protect ourselves. We get it. We've got good information. We've got great professionals in this part of the country that can give us guidance. So let's follow that guidance, protect ourselves, and we're all going to be better.
All right. And again, we appreciated Representative Shawan, and I'm sure we'll talk down the road, and hopefully we'll be in a better place down the road once we meet again. So again, we appreciate your time, and we'll see you down the road.
Thank you, Tyler.
All right.